Hello, and welcome to tonight's newscast. My name is Maria, and with me tonight I have three investigators here at NBC digging into a newfound medicine of hypnotherapy. With me tonight I have three experts within the field of psychology. Lana, who is a psych professor at Rowan University, Gigi, a psychologist who specializes in cognitive theory, and Julia, who is a social-emotional psychologist.
Good morning, America. My name is Dr. Gerstein, and I am the head of the psychology department at Cornell University. Hypnotherapy has long been misconstrued. The idea of hypnosis dates back to ancient Egypt and Hindu Vedist times, when hypnosis was viewed as a ritual to either communicate with spirits or heal the sick. In the 18th century, Franz Mesmer was able to propose the effects of hypnosis as well as a consistent method, which changed the views of hypnosis from occult or magical to scientific. In the 20th century, Milton H. Erickson changed hypnosis from a direct instruction issued by an authoritarian figure to a style of trance induction based on subtlety, persuasive language patterns. Hypnotherapy is a state of human consciousness involving focused attention, reduced peripheral awareness, and an enhanced capacity to respond to suggestion. Clinical hypnosis is used for healing, self-exploration, and change. Hypnotherapy has been used to treat pain, depression, anxiety, stress, and habit disorders. When performed by a trained professional, a few quick steps bring 85% of clients into at least a light trance. Clinical hypnosis can be simplified into 4 steps when regarding small behavioral changes. One step involves the hypnotherapist explaining the subject's behavior to them, the one that's unwanted. Step 2 involves both the hypnotherapist and the subject to create or describe a strategy for changing the behavior that's unwanted. Step 3 can only be complete once the subject is in some kind of trance. This means that the client must experience complete relaxation of the body, but full awareness of the mind. In this state of mind, the client is more susceptible to suggestion, allowing the hypnotherapist to help the client become more suggestible to the new strategy created in step 2. The last step is an evaluation in a later session after the treatment. Thank you for tuning in to the background of hypnosis, and back to you, Maria.
Thank you, Lana. Now, Gigi, after receiving this alternative form of medicine, what benefits can a person take away from this process?
Hi, Maria. First and foremost, thank you so much for having me onto your show today. And for those of you who do not know me, my name is Gianni Gonzalez, also known as Gigi, and I am a psychologist who specializes in cognitive perspective. Now, today I'm here to speak to you all about a specific topic: pros for hypnosis being used as a legitimate form of therapy. Yes, you got that right, a legitimate form of therapy. However, many people have many views about this specific topic. Some people believe in it and some people don't. Many psychologists, including myself, have proven and studied facts that hypnosis can improve anxiety, sleep disorders, depression, and post-traumatic anxiety. Now, for those of you who may be questioning what exactly are those things I may be talking about, sit tight. I'm gonna get there. Anxiety, for example, is when someone has a feeling of worry, nervousness, or unease. Typically, an event or something with an uncertain outcome has occurred. So, for example, when someone loses a family member, it really causes an emotional distress upon that person. Many people who experience any form of sleep disorders will notice a change in the way they usually sleep. Some of the signs of sleep disorders may include excessive daytime sleepiness, which can affect a mother or father or anyone who has a very hectic schedule and they need to be producing at their top quality. It may also include irregular breathing, increased movement during sleep. So while you're sleeping, you'll be all over the bed, and difficulty falling asleep. Now, while your spouse may be able to fall asleep in 30 minutes, 10 minutes, you might take a little bit longer to fall asleep. Patients who feel like they are depressed will experience a lack of emotional confidence. Depression affects the way someone thinks, feels, and the way they may act towards others. Now, many people misunderstand depression as either someone may be faking it or, oh, they're just like that, they're just like that. But what a lot of people don't understand is depression is something that can be cured. It can be cured, but it is also something that may lie beneath somebody. It is not a disorder that can be easily noticed and easily recognized, you know? It's something that has to take many and multiple studies to finally resolve the issue and get to the core as to what is going on and what is causing you to feel this way. Now, if a patient is experiencing post-trauma anxiety, it is because they have gone through a moment in their life in which they have not fully recovered or accepted what has happened. Now, there can be many examples for this specific topic. For example, we'll use armed forces and military. When someone goes to war, when someone goes to Afghanistan and they come back, they have viewed a specific scene that many other people have not witnessed. Many other people have not emotionally gone through that feeling. So what happens is that specific occurrence and that specific motion has occurred in their mind, and it keeps on replaying over and over again, which can eventually lead to depression, anxiety, sleep distress, many different factors can result from that issue. Not only that, but also when someone loses a family member or when someone has specifically gone through an event in their lifetime that has caused traumatic distress upon that specific person. Not only that, but hypnosis has also been used for centuries. Yes, centuries. During the Civil War, hypnosis was actually used on soldiers before they had to undergo amputation. So before they had to remove a limb from their body, they would experience hypnosis. Many clinicians believe that hypnosis can be powerful and it can be a therapeutic technique for a variety of conditions and disorders. Not only that, but many people who have had a bad habit of smoking or using drugs try hypnosis before reaching a rehab center or a doctor. Hypnosis can also be used for drug addiction. It can be used for clients who have an abnormal or disturbed eating habit. And it can improve the emotional state of mind for many clients. However, when being hypnotized, patients are in a quiet area where the patient feels comfortable and can emotionally feel relaxed. Now, if they are being hypnotized by a specific clinician or a doctor or a physicianist, they need to be able to feel comfortable and feel openly with that specific person. Now, in order for the process to be completed, the patient, like I said before, has to feel comfortable, they need to feel open, and they have to have already generated a bond with that specific person.
In addition to the pros, does hypnotherapy face a lot of cons, Julia? Or do they have severe drawbacks that may affect a person's everyday life?
Thank you for having me here today. Those of us who do not support the use of hypnotherapy do concede that for some people it can really help them deal with their chronic problems. Unfortunately, there have been many side effects, both severe and minor, reported in patients who have undergone hypnosis in a clinical setting. It is estimated that the chance of developing side effects from hypnosis is 22%, with 7% of these being reported as severe. This shows that people should really consider the possibility that they could develop problems after hypnosis. And this is a bit ironic because hypnosis is advertised as a safe, helpful tool to deal with problems, when in reality the patient can end up with worse problems after hypnosis than the problems they came to cure in the first place. Sigmund Freud himself has criticized hypnosis, saying that it may act injuriously and call into existence a severe hysteria, so that great caution is necessary in its use. In addition to just the possibility of developing side effects, hypnosis has been criticized for creating false memories in patients who have been put into a hypnotic trance in order to recover past experiences. In my research, there have been people who have reported memories of their own conception or birth. For example, people remember what was said in the hospital room after they were born. But this is not possible because infants do not understand language at this time. How then can we trust a type of therapy and use it seriously in a clinical setting when it creates false memories? False memories of conception and birth aren't even where this problem ends. Patients undergoing hypnotherapy have reported memories of their past lives, as well as predictions of future experiences, and even alien abductions. Therapists themselves have admitted to creating false memories in their patients just to see if it would work. Are we really supposed to believe that hypnosis is a legitimate form of therapy when it can corrupt and create memories in such a way? I and many other therapists do not think so.
As we come to the end of our program, we have one last special guest with us tonight by the name of Daniel. He is living experiment of hypnosis as a legitimate form of medicine. Let's listen into what he has to say about his personal experience.
Oh, are you filming?
Yes.
Yeah, my bad. So yeah, I tried to stop smoking. I tried gums, I tried patches, but nothing's working really for me. My friend Mike, he had like anxiety issues, and he told me that hypnosis like helped him. So I tried it, but as you can see, I'm still smoking. It didn't really do anything to me. So I went to Dr. David Spiegel. He's a professor at Stanford University. He's, I think, professor of psychiatry. To ask him why like hypnosis didn't work for me. He told me that some of his patients actually don't get hypnotized, and he explained that people who actually get hypnotized have greater coactive between components of the executive control network and I think the salience network in the brain. I didn't really understand much of what he said, but apparently I don't have this ability. So yeah, I'm still here smoking.